The level 3 is urgent. Conditions that could potentially progress to a serious problem requiring emergency intervention may be associated with significant comfort or affecting ability to function at work or activities of daily living. The time of physicians to see these patients are less than 30 minutes. Head injury, these patients may have had a high risk mechanism. They should be alert. GCS may be between 13 to 15 and pain scale can be between 8 to 10. Then moderate trauma. Patient with fracture or dislocation or sprain with severe pain, 7 to 8 scale. These patients having a level 3. The mild or moderate asthma with saturation between 90 to 95 are having level 3 scale. Dyspnea moderate. Patient with pneumonia, COPD, URI or croups may complain of or appear to be short of breath. Chest pain. Sharp localized pains worse with deep breathing, cough, movement or palpation not associated with shortness of breath or other signs that might suggest irritation on one of the lining inside like pleurisy. So these patients will be triage level 3. GI bleeding, upper GI bleeding, not actively bleeding, or patients don't show any sign that any stain of blood on his clothes or on the mouth or near the nose. With normal vital signs, there is always potential for deterioration. So a repeat set of vital signs should be done within 30 minutes or if there is any change in status. If these patients are given level 3 and they are sitting in the waiting area, the triage nurse must re-evaluate or recheck the vital signs of these patients. Vaginal bleeding and pregnancy, mild or no pain or pain less than 4/10 and bleeding is not severe or first trimester, LMP is more than 4 weeks and are previously positive beta HCG and normal vital signs should be reassessed within 30 minutes but can be given level 3. Seizures, non-seizure disorder are new onset but brief, less than 5 minutes, alert, breathing normally, protecting airway and normal vital signs are level 3. Acute psychosis and are having a suicidal attempts, psychiatric problems not really agitated but some uncertainty as to whether they are threat to themselves or others. Normal vital signs may be very emotional but are not violent and reasonably cooperative. Some bipolar, manic depressives, and they require safe, caring environment and some assessment of risk for overdose. These are all level 3 patients. Acute pains and moderate pains, whatsoever the reason, if it is between 4 to 7, are the level 3. Vomiting and diarrhea, age less than 2 years, dehydration and serious infectious can sometimes be subtle in very young children and vital signs may be normal. Dialysis. Electrolyte and fluid balance problems are common in these patients. Therefore, these patients are mostly coming in the hospitals where there is a dialysis centers. So these patients are repeatedly after having a dialysis get some shortness of breath. But however their vital signs are stable, these patients should be level 3. But these patients must be reassessed if they are sitting in the waiting area within 30 minutes of first check-in. So level 4, these are the semi-urgent or less urgent. Conditions that related to patient age, distress, or potential for deterioration or complications would benefit from intervention or reassurance within 1 to 2 hours. So time for the physician to check these patients is 1 hour or less. For head injury, minor head injury or patient is alert, GCS is 15, no vomiting, neck symptoms and normal vital signs may require brief period of observation. If time of interval from accident is more than 4 to 6 hours and has remained free of symptoms, these patients can be a level 4. Minor trauma, minor fractures, sprains, contusions, abrasions, lacerations require investigations or interventions, and normal vital signs and moderate pain 4 to 7. These are also level 4 patients. Abdominal pain, acute pain of moderate intensity with 4 to 7 over 10, or in a child in no acute distress. The severity of pain for appendicitis or cholecystitis or other potentially serious problem is not a reliable means of excluding these problems. Vital signs should be normal and the patient should not appear to be in acute distress. Then headache, no sudden or not severe, not migraine, not associated high risk features that are involved level 2 or level 3 headaches. So these patients can be having in level 4. Earache. The otitis media and otitis externa can cause moderate pain and 4 to 7 to severe. And these patients should receive analgesics. Therefore, these patients can wait until 1 hour. Chest pain, these patients should have no acute distress pain, no shortness of breath, no visceral features, no previous heart problem, normal vital signs. The pain is usually pleuritic, sharp, worse, with deep breath, cough, movement, palpitation. These patients may have had a chest wall injury or some strain of the muscle from cough or physical activity. Depressed patients, complaining of suicidal thoughts or have made a gesture but do not seem agitated. Some patients are coming with the triaging with the especially the females, that they the attendants of the patients will say that she lost her consciousness, but on the examination you will find that she is blinking her eyes and uprolling the eyeballs. So this is a malingering or she is in a hysterical condition. So don't consider it a state of mental unconsciousness. Corneal foreign body. If pain is mild or moderate, 4 to 7, 10, and no change in visual acuity. Back pain, if pain is chronic and old, and these patients only need for some sort of analgesia. Upper respiratory tract infections, patient with upper airway congestion, cough, aches, fever, sore throat are frequent visitors to the emergency department. Unfortunately, patient with strep thorax, throat or monoperitoneal abscess, epiglottitis, pneumonia, or other serious illness cannot always be identified in routine or quick look assessment. If there are significant respiratory signs or symptoms, perform an oxygen saturation, and if it is less than 95%, then you can upgrade the triage level. Vomiting and diarrhea, no sign of dehydration, age more than 2, can be level 3 patients. Patient with more than 10 episodes of vomiting must be level 3 as rather than level 4. And if the patient has a 24-hour before more than 24-hour having a loose motion also, and there is a sign of dehydration, these patients should be level 2 or 3 depending upon the assessment of hydration. Acute pain, moderate pain with minor injury or musculoskeletal problems should come in level 3. As was level 4. Level 5 are the non-urgent, and time for physician to examine is less than 2 hours. And these are the conditions that may be acute but non-urgent, as well as conditions which may be part of a chronic problems without evidence of deterioration. The investigation for some of these illness or injuries could be delayed or even referred to other areas of the hospital or healthcare system, or these patients can be sent back to the PHC from the after initial vital signs to the from the triage, and no need to be examined in detail by the treatment healthcare provider. So, this include the minor trauma, contusions, abrasions, minor lacerations not requiring closure by any means, overuse syndrome, tendinitis and sprains, nursing interventions, splinting, cleansing, immunization status, minor analgesics are all expectations of patient in this category. These include only the nursing interventions. They are not required to be seen by the doctor. For example, patients coming change of the dressing or injection, tetanus. Sore throat or upper respiratory tract infection, patient with the minor complaints, not severe and no respiratory symptoms, typical viral illness with normal vital signs or low grade fever less than 39 degrees centigrade. Vaginal bleeding can be normal means or painless bleeding in postmenopausal patients. If pregnancy is excluded and pain is not severe, it is less than 4/10 with normal vital signs, this patient can safely have a delay in assessment. Abdominal pain, mild pain with pain scale less than 4. These symptoms may be very challenging and frustrating for the healthcare provider or patient, neither of whom really want to be in the emergency department. Extended waiting period should lead to some reassessment or up triaging. Vomiting alone, diarrhea alone, no sign of dehydration, and age more than 2. All psychiatric patients should be in level 5. Some patients who are hard to group, they are very difficult to which level they should be assigned. If patient seems difficult to assign a triage level because they don't seem to fit any of the categories, the provider needs to either discuss the case with a colleague or make a judgment based on their experience or instinct. So, if patient looks sick and you are not sure, try them level 1 or level 2. Now comes the pediatric triage assignments. The following I will tell you: level 1, child, infant and in respiratory failure, shock, coma or cardiopulmonary arrest. Any child or infant who requires continuous assessment and intervention to maintain physiological stability. For example, coma, seizure, moderate to severe respiratory distress, unconscious, major burns, trauma, significant bleeding, and cardiopulmonary arrest. These are all in level 1. Level 2, any physiological unstable child with moderate to severe respiratory distress, altered level of consciousness, dehydration, and dehydration is difficult to accurately assess. Any suspicion should cause concern. Any child, infant who requires comprehensive assessment and multiple interventions to prevent further deterioration, fever, age less than 3 months is more than 38 degrees centigrade, temperature is not always a reliable indicator of the severity of illness. The younger patient can have serious problems even though the signs and symptoms may be normal. For example, sepsis, altered level of consciousness, toxic ingestion, asthma, seizure, postictal, DKA, child abuse, purpuric rash, fever, open fracture, ingestion, overdose, violent patient, testicular pain, laceration, or overdose, orthopedic injury with neurovascular compromise, dental injury with avulsed permanent tooth. So level 3, child, infant who is alert, oriented, well hydrated, minor alteration in vital signs. Intervention include assessment and simple procedures. Febrile child more than 3 months with a temperature 38.5 degrees centigrade, mild respiratory distress, and if the infant is less than 1 month must be level 3. It includes simple burns, fractures, dental injuries, pneumonia without distress, history of seizure, suicide ideation, ingestion requiring observation, only head trauma alert, and vomiting. Level 4, patient with vomiting, diarrhea, and no dehydration, age more than 2, simple lacerations, sprains, strains. Alert child with fever and simple complaints such as ear pain, sore throat, or nasal congestion. Head trauma without symptoms. And level 5, child infant is afebrile, alert, oriented, well hydrated with normal vital signs, and intervention not usually required other than assessment and discharge instructions. So vomiting alone or diarrhea alone with no suspicion or sign of dehydration is level 5. So this is all about the triage. Thank you very much.